Hello, Miss Willis. I'm Tamara, and I'm going to explain what I'm going to do in my video for this class. And first of all, I want to say that I choose the communication strategies as my content, and I choose the strategies from the chapter 9 and 10 from the book we use in the class. That's Interpersonal Relationship from Elizabeth Arnold and Kathleen Boggs. So the reference comes from this book. First, I will explain what's gonna be. It's gonna be the first encounter of the nursing from diabetes program with the patient that recently was diagnosed with diabetes. So this is the first meeting that they're gonna have. So this is important. And the strategies that I'm gonna use, they are related with the verbal response and actively listen. But before, I have to say the importance about the communication, because effective communication has been shown to produce a really good patient's outcome. So the communications, when it's effective, is so important. So it's really good to talk about communication strategies. And this relationship between the nurse and the patients is important to remind that has to be client-centered, where the focus is to the better outcome for the patient. So everything has to focus for the best for the patient. So I'm gonna right now say the strategy that you can notice in this video that I'm gonna show. And the first one is the minimal cues leads, where the nurse with the body language show for the patient, incentivizing them to keep talking about the history that they are saying or sharing the information. So with the body language we can do that. And another strategy is the clarification, because sometimes the patient can understand there's something wrong or say some ambiguous information, so we have to clarify everything to them. Another strategy that you can see here in this video is the silence, because we have to allow the patient has his time to think and process the information that we are sharing. And there is some emotions between these, so we have to allow the patient to take his time to, okay, I'm good right now. So the silence is so powerful strategies. Another strategy that is really important is using understandable language, where we have to avoid use jargons or clinical expression, because it can misunderstood the information we are sharing with the patient. And related with these strategies, there is another one that is the metaphors, where you use examples and images to bring the information closer for the patient's reality, or maybe allow them to visualize what you're trying to say. And in this video, we are able to see some nurse communication skills, where we can see in the building report where the nurse introduced herself for the patient, and we can see to the actively listen, because the nurse has to listen what the patient's requests and doubts, and attend the patient's doubts and answer with the information giving. And this skill we can find in the book too. So I hope you enjoy this video, and thank you so much. I did my best. Hello.
Hi.
Hi.
I'm Diego. We have an appointment for today.
Oh yeah, for sure. Come on.
Thanks.
You're welcome. You can take a seat.
May I put my lap here?
Yeah, feel free. Comfortable. Okay. So now that I know you, I'm going to introduce myself for you. I'm the nurse in Tamara, and I work here in the hospital of San Luis and the program the diabetes program. And I have been working for kind of 6 years, so I kind of have a walk here. So as I know that you was recently diagnosed with diabetes, so I would like to know, what do you know about it?
Well, the only thing I know about diabetes is that it could be dangerous if you eat a lot of sugar, and that's everything I know about it.
Oh, everything that you know that can get worse if you get a lot of sugar. Yeah, that's good to know. Do you know how that works if your body produce something or do not produce something?
I don't know.
You don't know?
I don't know.
Okay, so you use some kind of a math form to explain that for you. So imagine that my hands is a door.
Okay.
And this is inside the cells and outside the cells, the blood.
Okay.
So when you eat sugar, your sugar goes to your blood. So you have blood here in your sugar, but your cells need the blood, need the sugar. So your body, if you don't have diabetes, will produce a hormone that is going to open the door to the sugar got in. But as you have diabetes and your type of diabetes, your produce is defective, it's not enough amount, your medicine is going to help you to put your sugar inside the cells. Okay, so when you take your medicine, that will help your body and will make the insulin, that is the door, to put the sugar inside, works better. So you take your medicine, so the door is going to up and the sugar will be able to go inside the cells. Is that clear for you?
Yes.
Okay.
I can understand.
Yeah, but do you know if you keep taking the medicine, what can you feel?
I feel I can feel better because the medicine can help it.
Yeah,
right.
And if you have taken the medicine but don't eat enough amount of sugar, your blood sugar is going to be low, and you can be shaking and confusion and tired. So if that happens, you need to take some sugar, but not that much. Maybe a cup of Coke or candy, you can have that. So anytime you feel kind of tired and shaking, that's a sign that you are hypoglycemic. So your blood sugar is low, so you need to take. So when can you feel shake or tired? When your blood sugar is?
Higher.
No, higher. Your blood sugar is higher, so you take the medicine to make that low, but if you do not take the food, that's gonna be so low, okay? And then you're gonna feel shake.
Okay.
Okay? I'm seeing you're a little worried.
Yes, because I'm afraid. I don't really know how it works. So you're explaining me, and I'm getting more worried about, because I don't know if it can be dangerous or it get me to die.
Okay. Can I make another question? Do you have someone in your family that already had diabetes or died because of that?
I don't remember. Yes, I have an uncle that died by the diabetes.
Mm-hmm.
I just remember now because my mom told I was really young.
Oh, so that's making you more worried about it.
I don't know if it could be inheritance, and I don't know if I can get this from my bloodline.
Yeah. So now you told me that was making you worry, but my intention is make you understand what's happening and feel calm about it and secure.
Okay.
So I have a good news for you. You will not die about diabetes if you control your diet, the amount of sugar you take, and if you keep checking your blood sugar level.
Okay.
So if you keep checking, your body's not going to be damaged, because how longer your blood sugar is higher, that's going to damage your body, and then you can die soon. But if you keep checking that and see if it's stable, that means you can have a quality life, a really good life, even being with diabetes. So you need to control the amount of sugar you take and check your blood sugar level. So then you have a longer life and better.
You mean I can have a normal life even with the diabetes?
Yeah, if you control your blood sugar intake, the amount of sugar you eat, everything, and yeah, that's so great. So you need to control. So just for me to check if you understood, can you explain me what do you have to do to have a better life?
I have to control my diabetes with the diet and check my sugar, my blood sugar level.
Yeah, sure, cool. You took your time and you answered really good. So here's my mail, Anytime you want more information on any doubts, you can contact me. I think you have your physician's information too.
Yes,
and we have another meeting next week. Okay,
yes.
So I think that was a really good beginning of relationship between nurse and patient.
Thank you for helping me to clarify all my doubts.
Okay, you're welcome, and I hope you can have a better life.
Thank you.